Hello again. Last week we did hear about the polycystic ovarian syndrome, and this week Dr. Morrison is going to tell us a little bit more about the treatment plans for polycystic ovarian syndrome. At Wijnland, we always believe rather prevent than treat the patient. So let's listen to her, and all the advice is going to give us for plans, how you can make plans before you get the diagnosis and the final diagnosis of polycystic ovarian syndrome.
Good morning. Today we're going to be speaking about PCOS and the management of it. So for us, the management is slightly different between those patients who want to fall pregnant and those that don't. So if you're young and you want to control your cycle and treat some of the symptoms and prevent some of the symptoms of PCOS, it is slightly different to those patients that want to fall pregnant. But for both groups, the most important thing is lifestyle modification, because just losing 5% of your body weight can make a huge difference and get you to ovulate regularly. Not all patients with PCOS are overweight, but when up to about 70% are, and it's really important to control the lifestyle factors. So we try and get you to exercise regularly, at least 30 minutes a day, 5 times a week. We look at your diet, so trying to cut out sugars and refined carbs, increase your fruit and vegetable intake, and healthy, lean sources of protein, and increase your plant-based proteins. So just losing a little bit of weight can make a massive difference. In those patients who don't want to fall pregnant, your doctor might suggest that you go on to Cyclical Progestins, and this is just so that you have a bleed every few months to shed the lining, because that's one of the issues with polycystic ovarian syndrome. We may suggest that you go onto the combined oral contraceptive pill, and the reason for that is it is good to regulate your period. But the most important thing is that it ups your liver's production of sex hormone binding globulin. And this then binds to all the free testosterone that you have, which helps to control the acne and the hirsutism and some of the other symptoms. The pill also decreases the luteinizing hormone surge, and that then helps the ovary produce less androgens, which again helps with the symptoms. Because insulin resistance is so key in PCOS, in the causes and part of the syndrome, we may suggest that you go on to metformin. So we usually will suggest that you check your glucose tolerance test, fasting insulin and glucose ratios, or HbA1c. And if any of these are abnormal or raised, we may suggest that you start metformin, which is an insulin sensitizer. And that helps to decrease the insulin levels and increase the way that your body utilizes glucose. And that can help with weight loss, but it does have sometimes a few unpleasant side effects like GIT, dysfunction, nausea, diarrhea, and we usually titrate it up quite slowly. We may suggest that you go into myo-inositol, and myo-inositol is a secondary messenger that helps with glucose metabolism, and that can also help with some of the symptoms and help with sometimes with weight loss as well. There are other treatments we can suggest, spironolactone, cyproterone acetate, which will all help to decrease your androgen levels. If you are trying to fall pregnant, then the most important thing is to get you to ovulate. And this is not the only problem in PCOS. PCOS can be associated with poor egg quality and increased risk of miscarriages, but the important part for us is trying to get you to make a follicle and release an egg. So we can use the oral medication, and the oral medication is, your doctor may speak about Clomid or Femara or Letrozole. These are both slightly different in how they work, but the end result is they decrease your estrogen levels, increase your FSH levels, and that then gets one of the follicles to become a dominant follicle. We may add metformin to this, and that can also help to get you to ovulate. But some patients are resistant to the oral medication, and then we may go on to the injectable medication, which are called gonadotropins. This can be FSH alone or a combination of FSH and LH, but it's quite a fine line to titrate, because often if you give the oral medication, you don't make any follicles. We give you the injectables and you make too many follicles. So the risk of giving the injectable hormones is that the risk of twins and of triplets goes up quite substantially. So if you make too many follicles, or we can't get you to ovulate with these two treatments, then you sometimes suggest that you go on to IVF. And IVF, we obviously collect all the eggs, and we only put one embryo back, so this has the lowest risk of twins or triplets. We may also suggest that you use minoxidil, metformin, all those treatments the same as if you weren't trying to fall pregnant. With PCOS, often the patients, it's associated with poor body image, poor self-esteem, disordered eating, depression and anxiety. So if you are feeling like this, it's important to tell your gynae or your doctor, because there are treatments that we can do, and we can refer you to the psychologist and things that can help.